Since the 1960s, the spending of healthcare in the United States has increased rapidly. According to the Peterson KFF Health System Tracker, spending totaled to $74.1 billion in 1970 and reached $1.4 trillion in 2000. Especially during the pandemic, the study states that 10.4% was spent from 2019 to 2020, and the latest rate in 2023 is estimated to have increased by 7.5%. The evidence shows that elements related to healthcare such as medicine, hospital care, outside care, etc. has become so expensive that Americans as a whole are paying over trillions of dollars for what should be easily accessible. Healthcare is the practice of healing and treating people with illnesses, disabilities, injuries, and more. It requires the services of hospitals, clinics, pharmacies, and professionals specialized in specific areas of health. The goal is to provide the patients a relatively decent quality of life despite their illnesses. For healthcare, what is always required is a form of insurance to help cover the majority of the high cost of care. In exchange, the person pays the premium in whatever amount proposed monthly. Even though this plan and healthcare in general seem efficient in helping people get the care they need without spending so much money out of pocket, the reality is that people still need to pay a lot in order to receive that care. For the rest of this speech, I will discuss the consequences of expensive healthcare, the causes of it, and the solutions proposed to make healthcare cheaper. Let's first start with the problem and its consequences. Expensive healthcare is one of the biggest problems in the United States. It forces many Americans to go into debt. According to the KFF in their article, Americans' challenges with healthcare costs, about 4 in 10 adults, 41%, report having debt due to medical and dental bills and other things such as credit cards, collection agencies, banks, and more. Poor people, uninsured people, minority groups, and women are the ones who incur the most debt. Despite having insurance, it sometimes does not help people better afford their care. The National Institute of Health states that the motivation of payers and PBMs who cover the cost for patients collect more in premium dollars than they spend on healthcare services for their members. Manufacturers have to raise the prices that cover the manufacturing, payer coverage gaps, formulary placement and restrictions, and the rebates and discounts. There are serious consequences that come with postponing or relinquishing necessary care. People can suffer severe withdrawals from the lack of their medicine. An illness or injury can get serious enough to cause irreparable damage to the body or death. Many people have died or are permanently disabled due to putting off necessary care that could have saved their life due to it being too expensive. Despite the high costs, there can still be low-value care. The Commonwealth Fund states that low-value care is services that offer patients with clinical presentations, no benefit or benefit less than cost that leads to unnecessary spending and patient harm. The cost of overtreatment has been estimated to be between $158 billion to $226 billion each year. Overall, these problems are debilitating the healthcare system. Now on to the causes of expensive healthcare. According to the Peter G. Peterson Foundation, healthcare spending is a function of price, dollars charged for healthcare services, and utilization, the amount of services used. These are mainly expensive due to an aging population and healthcare prices. Older people require more healthcare, so they spend more on healthcare. The foundation estimates that the share of the U.S. population aged 65 and over has increased over the past several years, from 14% in 2012 to 17% in 2022. It's expected to increase by 21% by 2032. Also, more older people are going on Medicare, so it is estimated that the cost will double over the next 30 years. As for prices, the cost of healthcare services typically grows faster than the cost of other goods and services in the economy. The cost for Medicare has grown at a rate of 3.1% per year compared to the 2.6% for goods and services in the past 20 years, as recorded in the Consumer Price Index for all urban consumers. There are 3 proposed reasons for the increase of healthcare prices: the invention of new technology that will create more expensive procedures and products, administrative waste in insurance and payer-provider systems as a result of the complexity of the U.S. healthcare system, consolidation of hospitals that would decrease competition, or a monopoly which will allow providers to increase prices. Thus, these causes are the main reasons why people have to pay more for medicine and hospital services. However, all is not lost. There are some solutions already made and in progress to this problem. Back to the Commonwealth Fund, it proposes strategies to control spending. One is to improve competition. Some proposed methods are price transparency, support consumer shopping, and limit provider consolidation of their anti-competitive practices. Another is to lower prices and price growth directly. How this would be done is to require the providers to justify high prices and then shame them. States could be allowed to discourage high prices. Prices could be set that can simplify the process and maintain new services. Make holistic strategies to curb spending and maintain insurance agencies. People would be assigned to insurers or providers, and those organizations would be held accountable. Premiums would be regulated and alternative payment models and global hospital budgets promoted. There will be more monitoring and reporting of spending. The National Health Council also identifies some possible methods. Reduce barriers for the development of generic and biosimilar products and expedite approval of certain generic applications. Patent settlements and other types of patents that postpone the access to lower-cost medication could be curbed. The FDA could prioritize more review applications in the cases of few available generic options or drug shortage. The encouragement of biosimilars can also encourage competition and more low-cost products, assure proper prescription, and remove disincentives that put high prices over low prices, improve coverage and reimbursement requirements. The lowest out-of-pocket limit will be added to the Part D benefit structure in order to benefit more patients. Certain organizations can add more to the Center for Medicare and Medicaid, or CMS, Medicaid value-based purchasing final rule, and encourage contracting and value-based arrangements. The Patient-Centered Outcomes Research Institute's new mandate will be leveraged to consider all patient outcomes in regards to important impacts of patients outside of health. Support chronic disease management and prevention. People should expand access to home and community-based services in Medicaid. Financial barriers must be broken down by requiring adequate coverage for services in order for patients to receive coordinated care. People must invest more in the federal public health system and focus more on public health programs via the Center for Disease Control and other federal entities. Promote transparency on price and cost sharing. Enhanced tools will be provided in order for patients to understand insurance coverage of the services and products and thus make an informed decision. Manufacturers will be required to report important information and disclose supporting documentation that justify high prices. CMS will report more on drug costs and spending. A method will be created to ensure most cost savings and price concessions are passed to the patient so they have lower costs and for drugs and rebates. Although these solutions may have drawbacks, they may be the most efficient way to decrease expensive costs of healthcare. In conclusion, those are the problems, causes, and solutions to expensive healthcare in the United States. While a lot of money is required to afford the expensive equipment, products, and services, and there has to be a give or take between patients, medical centers, and insurance companies, it is easy to be taken advantage of so that the majority of the cost is put on the patients rather than the insurance companies. It is underestimated the cruciality of affordable health care. People's lives depend on necessary care because anyone can get sick or injured at any time. Yet corporate greed has used that fact for their own gain and put profit over the well-being of the patients. The preventable death of people and incurring debt has irreparably affected many lives economically, physically, and mentally. This is not indicative of a first world country like the United States. However, if people further perceive change and the solutions are continuously implemented, over time, healthcare will be accessible to more people as it should be. Alrighty, now let me show you my visuals. Okay, this is the graph. This is the graph of the how expensive healthcare is compared to other countries in the world. The U.S. has the most expensive healthcare, as you can see. And another graph showing how it has gone up. Yeah. And another graph showing how much has gone up since 1960 to 2010 and beyond. And this shows how the percentage of amount of money spent on things such as Medicare, Medicaid, private insurance, and uninsured when it comes to trying to afford healthcare via insurance. And that is my speech on the problems of expensive healthcare. Thank you for listening.